Hello Fort Campbell, Dr. Troy Prairie here. Today we're going to talk a little bit about what's going to happen if you get a positive result back. We've got a number of tests that are out. First thing that's going to happen is you're going to get a phone call from one of our triage nurses to tell you about your positive result. We're only calling folks between 7 a.m. and 10 p.m. We're not calling in the middle of the night. So if we do happen to get results back at 3 in the morning, for instance, we'll call you first thing in the morning and talk through. That's number one. Number two is we want to know, and most importantly, how are you doing? How are your symptoms? Are you recovering? Are you still struggling with the disease process? We're going to ask you a series of questions about temperature, about your respiratory symptoms, how are you feeling, any shortness of breath, those types of questions. Based on how you answer it, the vast majority of folks, upwards of 90% or higher, we believe are going to be able to manage this disease at home without needing further evaluation. So we're going to ask you, we're going to continue to call you every 48 hours, which is our standard protocol right now. We're going to ask you to stay at home, continue to isolate, continue to take care of yourself. And then again, we'll be calling you and checking up on you. If at any point in time you feel like your symptoms are deteriorating and that you need to be evaluated, we'll have a phone number for you. You can call anytime between 6 a.m. and 9 p.m. To talk to one of our triage nurses by calling the appointment line and being redirected to that COVID clinic, and we'll get you right back in to be evaluated. Now, when are you going to be released? When are you considered better? You've got a positive result. Well, the Center for Disease Control, or CDC, tells us that if you've had if day zero is the day you first get symptoms, that's what we define as day zero. We calculate 7 days. You have to stay in isolation if you've got a positive result for a minimum of 7 days. And the last 3 days need to be what we call relatively asymptomatic. And what I mean by that is symptoms pretty much resolved. We don't want you to have a fever or need to take fever-lowering medication to get rid of a fever. So no fever for 72 hours. And then most of your respiratory symptoms should be improving. You will, in many cases, have a residual cough. A lot of people, after they have a respiratory infection, will continue to cough, and that's because you've still got sputum or phlegm inside, and that causes bronchospasm. So a little bit of a cough is okay, but if most of your other symptoms have resolved for 72 hours and it's been at least 7 days, then on that last phone call that you get from our triage folks, we'll talk through that, and we'll give you reassurance at that point that you're released, or what we call recovered. You'll be cleared as a recovered patient, and you'll be sort of, if you're a soldier, released to go back to work. Everyone else advised that it's now safe to go back to work. I hope that's helpful. Together we can beat COVID. Thank you very much.